Hello, my name is Melissa, and today I'll be going over ketamine as a treatment for depression, brief history, its mechanism of action, and some important clinical trials. Learning objectives for this presentation include to describe the pharmacological mechanisms by which ketamine exerts its anesthetic and antidepressant effects on the nervous system, and identify the benefits and potential risks of ketamine in the treatment of depression compared to that of traditional antidepressant treatments. So a brief history of ketamine. In the 1960s, it was first discovered and approved by the FDA as an anesthetic in order to numb patients for medical procedures. In the year 2000, Berman and colleagues conducted a clinical trial that was the first to provide strong evidence of ketamine's potential as an antidepressant treatment. And in 2019, a nasal spray containing a derivative of ketamine, S-ketamine, was approved by the FDA for treatment-resistant depression. As we can see, ketamine as a treatment for depression is a very recent development, and it seems to hold a lot of promise in helping patients combat the debilitating disorder. But how exactly does ketamine work in the brain to provide these antidepressant effects? So ketamine has many mechanisms of actions, but they are still not very well understood. However, an established mechanism of action is its high affinity for NMDA binding sites. Ketamine is a non-competitive antagonist at the NMDA receptor, which, as you may recall, is a glutamate receptor. And glutamate is a primary excitatory neurotransmitter in the brain, and it's involved in regulating mood, cognition, and memory. And inhibition of the NMDA receptors decreases synaptic transmission, which is thought to be the key mechanism behind the anesthetic effects of ketamine. As for its antidepressant effects, one theory is that these effects are due to its binding to NMDA receptors on inhibitory GABAergic interneurons, causing an increase in glutamate ultimately and strengthening synaptic transmission in certain areas of the brain, such as the prefrontal cortex. However, researchers believe that the antidepressant effect of ketamine is due to more than just the antagonistic effect on NMDA receptors. Besides NMDA and glutamate, ketamine also interacts with a number of other neurotransmitter systems, including opioid receptors, monoamines, GABA, as well as AMPA receptors. So there's a lot going on and a lot still to find out about how exactly ketamine works pharmacologically. Treatment-resistant depression is when one's depression does not improve after multiple attempts at standard treatments. And it's thought to affect about a third of those with major depressive disorders, which is a very large amount. In multiple trials, IV administration of ketamine was shown to start alleviating symptoms within just a few hours, which is very remarkable. And in one study by Dye and colleagues, it showed a nearly 50% reduction in depressive symptoms pretty much within the first few hours. And as we learned in the last module about affective disorders, traditional antidepressant treatments such as SSRIs can take up to multiple weeks to show a decrease in depressive symptoms. So ketamine's rapid effects are really what sets it apart from other treatments, especially in cases when the patient is at high risk of attempting suicide. A matter of difference between hours and weeks could really make a life or death difference. So while ketamine shows a lot of promise in the treatment of depression, especially treatment-resistant depression, the downsides and potential risks of this treatment should be considered thoroughly as well. Although its rapid onset makes it an attractive option, it was found that ketamine lost its effectiveness after about a week in most trials, meaning that it would have to be taken repeatedly to maintain the therapeutic effects, and it usually is in trials or treatment for depression. Some studies show that repeated use actually had a positive and cumulative effect on most patients, with no impairment to cognitive functions. However, there are some studies that report side effects such as dizziness and some dissociation, but they quickly resolved in that same day. One concerning case that should be mentioned, though, is one clinical trial of ketamine treatment, and there was 4 deaths by suicide in that one trial after they stopped taking the ketamine. And 2 of the 4 patients had not shown any signs of suicidal ideation beforehand. This suggests that there are increased risks associated with continued use, despite it being a low dose. Additionally, it has been observed that negative symptoms can arise, similar to that of schizophrenia, in healthy patients at chronic low doses. So in conclusion, ketamine as a treatment for depression is a very recent and promising development, but much more research and clinical trials are needed in order to more fully understand exactly how it works, especially the antidepressant effects it has. Due to its potential risks, many researchers are interested in understanding the mechanism of action of ketamine and potentially isolating the beneficials to develop a new drug that doesn't have as many downsides. Nonetheless, it'll definitely be interesting to follow along on this treatment and future treatments in the future, especially considering how many people it's helped so far in the few years that it's been approved as a depression treatment. Here are my references, and thank you for watching.